Extended time at home sometimes means that we are putting off on our to-do list, but there are some things that we definitely don't want to do that for. We've got Dr. Jennifer Heller. She is the medical director of the Wound Center at GBMC. Welcome.
Thank you. Good morning.
Happy to have you here. So tell us a little bit more about the Wound Care Center in general.
The Wound Care Center is comprised of many different healthcare practitioners, from nurses who have decades of experience and have been at the GBMC Wound Center for many years. In addition to the nurses, we also have advanced level practitioners, as well as a diverse specialty panel of doctors, including podiatrists, general surgeons, vascular surgeons, as well as a plastic reconstructive surgeon.
And how would someone know if they need to address their wound with the Wound Care Center at this point? What should they be looking for to know that they need to go and get some added medical care?
So just to back up, just in brief, a wound is any break in the skin. Mm-hmm. And certainly if with some time you notice that the wound appears to be getting larger, more painful, or there's drainage coming from that wound that may or may not have an odor associated with it, those are all important signs that the wound is getting worse and not better, and one should certainly seek treatment. As well, if someone has a temperature, that's also very important.
How long should it normally take a wound to heal?
The wound healing rate depends on a lot of different factors. Some of it depends on the location or the depth of the wound, but really most importantly, it depends on the individual characteristics of the patient themselves. Patients who are on certain kinds of medicines, such as blood thinning medicines or antiplatelet medicines, have a longer time to heal. People who have medical problems, such as immunosuppressive conditions, such as cancer, or rheumatoid arthritis or diabetes, all play a role. As well, social issues such as smoking also can impede or slow a wound to heal.
Is there anything that we can do, just the average person, to try and help our wounds heal better?
Absolutely. We can make sure that we have a good diet and really institute and implement a lot of different protein-rich foods. As well, having a multivitamin is also very important to help beef up all of those essential and trace elements that are really essential to wound healing.
And how does GBMC's Wound Care Center differ from other centers, and just in terms of your approach?
We pride ourselves at the GBMC Wound Center for having a one-stop shop for people and their wounds. So if someone comes in with a wound with any kind of cause that's underlying it, we have the specialists at the ready to be able to expedite care in their state-of-the-art fashion, depending on their particular area of expertise.
All right. And where can we go for more information on GBMC's Wound Care Center?
Please feel free to check out our website, or alternatively, we have a very easy to remember number, 443-849-HEAL.
All right, Dr. Heller, thank you so much for your time today, and we really appreciate it. We'll be right back with more Midday Maryland right after this. Stay tuned.